Hello everyone, Dr. Fink here. Today we'll talk about which markers you should monitor while you're taking anabolic steroids in order to keep you healthy. So again, quick disclaimer, this is not medical advice, this is just entertainment. For those with a medical condition, please consult with your physician. Again, anabolic steroids are bad for your health. I don't recommend anybody to take anabolic steroids, but in case somebody takes anabolic steroids, those are the markers you should monitor in order to prevent long-term effects on your health. So let's start with the hormones. So we need a hormonal panel. In case somebody is only taking testosterone, for example, and he gets that testosterone from some non-pharmacy sources, let's say from some underground lab, online or whatever it is, they don't even know if that's the right drug in that vial, and they don't know the dosage. Okay, so assessing your serum testosterone levels can give you a good idea if the testosterone you're taking is legit and the dosage that's in the vial actually. In case you take other steroids, other compounds, this doesn't make too much sense. Free testosterone also is just in case you want that marker as well. So remember, there is free testosterone and there's total testosterone, and the free testosterone is basically the bioavailable, the non-bound testosterone. So this is pretty much optional. LH-FSH, luteinizing hormone, follicle stimulating hormone. So those two hormones will be very much suppressed when you take any type of anabolic steroid. And those are important to monitor, especially if you want to conceive in the future, because these are important to get you back your natural testosterone and sperm production. Okay, so LH-FSH especially important to monitor towards the end in the recovery phase of anabolic steroid cycle. Estradiol, very important. There are some compounds, especially testosterone, that can aromatize, which means they will convert to estradiol, the female hormone. So depending on the individual, the rate of aromatization is different. Some aromatize a lot, some very little. And in order to know that before getting any symptoms, it is very important to look at your estradiol levels in the blood. If you don't do so, you could end up with gynecomastia, which is basically the build of female breast tissue in the male, and it is very hard to combat that. Of course, there's some drugs you can take for that, but if it's too late, then surgical removal is often the only way to do so. So monitoring your estradiol levels can give you a good idea if you need any ancillary drugs to prevent aromatization, which there are on the market. But again, if you don't aromatize a lot, you don't even need those ancillary drugs that prevent testosterone being converted to estradiol, because you need also a certain amount of estradiol to live, to function healthy. So estradiol gives you a good idea where you're staying at if you need any other drugs like Arimidex or such. And DHT, dihydrotestosterone, also, this is basically converted from testosterone as well. There's an enzyme called 5-alpha reductase, which is converting testosterone into DHT, and DHT is also important in our body, but if you have too much of it, especially if you take enormous amounts of exogenous testosterone, DHT can also increase a lot. And DHT does bad things if it's in excess in our body. It can cause acne and hair loss, and this, if you are afraid of those side effects before they arise, you can measure your DHT levels, and in case your levels tend to be high, you can use a 5-alpha reductase inhibitor like finasteride, dutasteride, and they prevent the conversion of testosterone into DHT. Prolactin, especially if you take 19-nor testosterone, Compounds such as nandrolone, prolactin can also cause the build-up of female breast tissue, gynecomastia. And then we have SHBG, which is sex hormone binding globulin. If you have elevated sex hormone binding globulin, as the name says, these molecules will bind to the androgens and basically make them unavailable. Okay, so if you have too much of those, there's also ways to reduce them. All right, next will be the lipid profile. So HDL, high density lipoprotein. Again, it's the good type of cholesterol. It's basically removing the bad stuff from your blood vessels and bringing it back to the liver. And then we have the bad cholesterol, low density lipoprotein. And then we have our triglycerides, which is also a type of fat in our blood. So HDL, we want high HDL, and anabolic steroids are known to decrease HDL, especially oral steroids. So we want to make sure that we stay in healthy ranges. LDL can increase also with anabolic steroids. The bad cholesterol, we want to keep that low. Okay, HDL, we want to keep it high. LDL, we want to keep it low. And triglycerides, we want to keep that low as well. So in case you take a blood panel, you see low HDL, high LDL, and high triglycerides, that's a red flag. Immediate action is necessary. Liver function, also very important, especially if somebody takes oral steroids. So we have several enzymes that give us a good idea about how well our liver functions. We have AST, ALT, GGT, and we also have bilirubin. So all those are important, especially again if you are taking oral steroids. Next, let's look at the kidney function. For the kidney function, we have creatinine, which is basically a waste byproduct. And here we have to bear in mind that creatinine also increases if we eat a lot of protein and we have a lot of muscle mass. So it can be a little tricky to judge based on creatinine, but it is a marker for our kidney function. Then we have BUN, blood urine nitrogen, which is also a waste product of the kidneys. And then we have a very important one, eGFR, which is the estimated glomerular filtration rate. So this is basically telling us how well our kidney is filtrating the blood. Okay, so the higher the better, and if you see lower numbers for the eGFR, you can take other tests, and this is important to understand that eGFR is estimated based on creatinine. Okay, and creatinine, especially in bodybuilders or people with a lot of muscle mass who eat a lot of protein, is elevated, okay, due to the muscle mass and the high intake of protein. So this can bias the results of eGFR. So sometimes you might have a low eGFR because the calculation of, because it's called estimated, okay, is based on this creatinine number. So it doesn't mean that you must have kidney dysfunction if you have a low eGFR, especially if you have a high amount of muscle mass and if you eat a lot of protein. But in any case, if eGFR is too low, I would recommend to do further tests to look into your kidney health. Then we have we have hemoglobin hematocrit, very important. It's basically how much red blood cells you have in your blood. Red blood cells are great for endurance. They transport oxygen to our muscles. So the more we have, the more endurance we have. But if we have too much, then it can cause the blood to be very viscous and cause clots and cardiovascular problems. And especially compounds such as testosterone or boldenone or anadrol are notorious to increase hemoglobin hematocrit, so red blood cells. And we should monitor those. And this goes in hand with blood pressure. Also, blood pressure, so when somebody is taking anabolic steroids, weight usually increases, food intake increases, salt intake increases, we retain more water, and this can lead to increase in blood pressure. And this needs to be monitored. If you go too high with the blood pressure, especially for longer periods of time, this can lead to serious kidney damages. And then lastly, PSA, prostate specific antigen. So this is the basically how healthy your prostate is, and if you have a PSA that is steadily growing, then that's a red flag. You should monitor it more closely and do different tests to see if your prostate is working well. And remember, in the prostate there's also androgen receptors, and androgens bind to these receptors and make that prostate grow in some cases. That's why we have to closely monitor PSA, the prostate-specific antigen. All right, I hope this was helpful, and these are basically the values, the markers you should monitor before even taking anabolic steroids to see where your baseline is at, during an anabolic steroid cycle, and afterwards to see how bad or how well you react to anabolic steroids, and then how you recover after the cycle. Okay, so again, anabolic steroids are bad for you, for your health, and it is very important to monitor your health in case you abuse with those compounds. Thank you for watching, and have a wonderful day.